Hello, this is Dr. Do again. This video, it continuously the systemic approach of medicine, continuously from previous videos, start from the invisible four major organic compounds and the disease associated with this organic compounds, and then move on to the cellular level, and also diseases associated with the cells and internal structures, and then move on to the tissue level, which is invisible, and talk about the diseases associated with these four major tissues in the body, and then move up to the organ system levels and talk about the integumentary system from outside to the inside, which are the skins, and also diseases associated with the skin, and also talk about the skeletal muscle system, and also diseases occur in the system, and previous couple of videos move on to the respiratory system and associated diseases. I think I finished out with the symptoms, for example, the chest pain or dyspnea caused by the respiratory system. So today I'm going to move on to the cardiovascular system or circulatory system. Let me just bring up continuously from the chest pain clinical presentation. I already mentioned it could be caused by the lung diseases or could be caused by the heart diseases. So let's just bring up the chest pain caused by the cardiovascular diseases. First of all, let me just talk about the characteristic of the chest pain, if it is associated with the circulatory system or associated with the heart. What kind of chest pain it is? First of all, it is excruciating pain, which usually is very painful, particularly is ischemia, cardiomyopathy infarction, and also if that's the case, the chest pain usually is exertional, which means associated with increased activities or accelerated speed, particularly increased activity of upper extremities or running faster against the stairs or against the hills. So that increase the oxygen demand, increase the burden of heart. So that's the time to show whether the heart has ischemic or not ischemic. That's the mechanism for the treadmill test. Challenge the heart, increase the activity, increase demand of the oxygen, so then to see whether the heart can meet the requirement or the demand of the oxygen increase during the activity. And also the pain associated with the heart or could be radiating to the shoulder, particularly left shoulder or left arm or fingers. So if that's the case, it is because of nervous system referring pain or radiating pain. I'm going to talk about the mechanism when I talk about the nervous system. So this is about the characteristic of the chest pain caused by the circulatory system or cardiovascular system. In terms of the causes, I think you probably know it. Coronary artery sclerosis or sclerotic coronary disease, or acute myocardial infarction. That's the major causes. Of course, there's some other, like stenosis of the aorta, for example, also can cause this kind of chest pain, mimic the heart attack, but it is not. And also sometimes the stenosis or the torn of the artery can also cause this chest pain. But anyway, so this is about talk about the cardiovascular system disease. Let me just bring up the fundamental structure of the heart, the circulatory system. So we know heart works 20 and 24/7 without any minute pause, and we keep working and circulating, pump the blood, carry the oxygen to the tissue to meet the requirements of the metabolism, and also to bring the waste carbon dioxide to the lung for exchange. In terms of details, the ventricles and the heart has 4 chambers, 2 atria, 2 ventricles, and the atria are separated by the septums are the structure separated between atria and between the ventricle. So the ventricular septum or the atrial septum, and also the valve structure separate the atria from the ventricles. So for example, the mitral valve, which separate the left side, left atrium from left ventricle, and also the tricuspid valve, which is separate the right atrium from right ventricle. So this is the structure. And also heart itself has blood vessel to supply it. We know heart is the organ to supply the whole body, about 4 liter at least, 4 liter of blood circulating continuously from this size about the fist. So the heart size is about our fist size. So if you imagine, that's a tremendous work actually. And so the blood vessels supply the heart itself, called coronary arteries and coronary veins. So this is having said that, then the cardiomyopathy infarction is because of the ischemic from this coronary artery itself, either from the thrombosis or from the spasm. So then the heart will feel the demanding work of the heart, need oxygen constantly. But if this blood vessel is blocked, or if this blood vessel is spasm, so that will really decrease oxygen, which cannot meet the requirement of the heart function. So that's called ischemia. Ischemia itself depends on the location, depends on the severity, depends on the degree or how the area. So it could be reversible. For example, the spasm caused the ischemia could be reversible when the coronary artery starts to dilate, but could be irreversible if the beyond the time for recovery, or the inflammation is severe. So if that's the case, then it's irreversible. So anyway, so this is about the coronary artery itself and the heart function. And move on. If it is talk about this circulatory system disease, just briefly mention the circulation, how the blood circulates in the body. For those who had medical training, you know it. For those who do not have it, I'll just briefly talk again. So the systemic circulation, this is how it works. The left ventricle connects to the aorta. The aorta connect to the different level of the arteries and become the capillary, and the capillary extended to the veins. So the capillary is where the exchange occur. So the artery carry the full loaded oxygen exchange at the tissue of the organs to release the oxygen and loaded carbon dioxide, and then carried by the vein back to the right atrium. So the right atrium has openings through the right ventricle, and right ventricle has the pulmonary artery, and at this moment the blood is already blue instead of red because of the full loaded of carbon dioxide. So through the pulmonary artery and then circulating the lung and exchange at the capillary formed the structure wrapping on the alveoli, and then that's where the exchange occur and collected to the vein and back to the left atrium. So the left atrium through the valve structure, mitral valve, and the blood sucked into the left ventricle, continue another circle. So this is the structure of the circulatory system, and associated with the diseases I just briefly mentioned continues from previous video. The chest pain, how can you tell it is from the heart instead of from the lung or from the other structures? So I'm going to stop here, and hope it helps, and or at least hope that triggered your interest to search more, to understand more about ourselves. So I'm going to stop here, and thank you for watching. I'll see you next time.